So we're gonna start by doing the straight leg raise test and the well straight leg raise test. I'm gonna have the patient laying on supine. I'm gonna grab the lower aspect of the leg and the upper part of the knee. I'm gonna take the patient into a full hip flexion. A positive test will be the patient experiencing pain before reaching the 70 degrees, implicating a irritation or compression of the sciatic nerve. A more serious injury will be the patient experiencing pain during the before reaching 30 degrees or replicational symptoms. For the Wells test, it will be doing the same motion, but the patient will be feeling pain or replicational symptoms on the opposite side that we're testing. Any pain? No? Perfect. For the Wells test, the implication will be a large space occupying lesion such as a herniated disc. This test is performed bilateral. So now we're gonna be performing the slump test. I'm gonna ask the patient to be seated. I'm gonna ask the patient to come into a slump position. Take his chin to the chest. I'm gonna apply over pressure. Now I'm gonna ask the patient to extend his knee and to dorsiflex. Any pain? I'm gonna ask the patient to do the same thing but with the other leg. Slump position, extend, dorsiflex. Perfect. Positive test will be the patient having radiating pain, implicating a impingement of the spinal cord or nerve roots. This test is performed bilateral. So now we're gonna be performing the quadrant test. I'm gonna have the patient standing. I'm gonna have the patient performing a extension of the back or laying back, perform a right side bend, and then perform a rotation in this direction. Then I'm gonna apply overpressure. Positive test will be replication of the symptoms, implicating radiating symptoms, which mean the compression of the lumbar spine, lumbar nerve roots, a local pain implicating pain pathology of the facet joints, or symptoms in the PSIS, which indicates SI joint dysfunction. This test is also performed bilateral. So now we're gonna be doing the lower quarter neurological screening. Here we're testing the different nerve routes. The different nerve routes that are in the lower body is the L1, which is in the upper thigh. We got L2, which is in the mid thigh. We got L3, which is in the lower thigh. Then we got L4, which is on the middle aspect of the foot, of the leg, my bad. Then we got the L5, which is in the dorsal aspect of the foot. Then we got the S1, which is in the lateral aspect of the foot all the way to the peroneals. And then we got S2, which is in the posterior aspect of the foot, which is the gastrosoleus and the hamstrings. For doing the testing, I'm gonna see if the patient can differentiate between a dull or sharp. So I'm gonna tell the patient which one is which. So this is sharp, this is dull. I'm gonna tell the patient to close his eyes, and for purposes of the video, I'm just gonna be testing L2. So the patient already knows the instruction. Can you feel this? Yes, is it soft or dull?
Dull.
Perfect. Positive test will be the patient not being able to differentiate between soft, dull, or sharp, and implications will be any nerve root dysfunction in the nerve root that I test. This test is performed bilateral, and it's also performing all of the different nerve roots that I already explained. Now we're gonna be doing the motor testing. I'm gonna test for the patient's strength, basically. So I'm gonna tell the patient I'm gonna put some resistance or the different exercises that the patient's gonna be doing. So the first one is gonna be hip flexion. I'm gonna resist. Brings your knee up. Resist. Perfect. So that's gonna be L1 and L2. For L3, I'm gonna ask the patient to perform a knee extension. Resist it. Perfect. For L4, I'm gonna ask the patient to long sit, use it back, and I'm gonna tell the patient to bring his toes up. Perfect. And then for L5, I'm gonna tell the patient to bring his toes toward him. Perfect. For S1, the patient is gonna be doing erosion, or taking his foot to the side. Persist. Perfect. And then for S2, I'm gonna have the patient laying on his stomach, and I'm gonna tell the patient to bend his knee. Persist. Perfect. Positive test will be the patient not being able to perform this exercise, implicating a nerve route dysfunction of the exercise that he wasn't able to complete. This test is performed bilateral. Now we're gonna be doing the reflex testing. I'm gonna start by testing L2, L3, and L4, which is gonna be the femoral nerve. I'm gonna palpate here. Then we're gonna be testing L5, which is in the in this part. Then I'm gonna ask the patient to lay on his stomach. Now we're gonna be testing S1, which is in the Achilles part. And then finally we're gonna be testing S1, which is in the lateral tendon of the hamstring. Positive test will be the patient not being able to have a reflex implicating a neurological dysfunction. This test is performed bilateral. So now we're gonna be performing favors test. I'm gonna have the patient laying on supine. I'm gonna take the patient into a flexion, abduction, and external hip rotation. And then I'm gonna take the patient into hip extension. And then I'm gonna see if the patient experiences any pain on the SI joint, implicating SI dysfunction, or if the patient has pain on the inguinal side, meaning a hip dysfunction. This test is performed bilateral.